The nerve that controls vision. Option A, olfactory, optic, facial, vagus nerve. The correct answer is option B, optic nerve. The optic nerve, second cranial nerve, carries visual impulses from the retina to brain. The sense of smell is controlled by olfactory nerve, optic nerve, auditory nerve, glossopharyngeal nerve. The correct answer is option A, olfactory nerve. The olfactory nerve, first cranial nerve, transmits smell sensation. The organ of ear is nose, ear, eye, tongue. The correct answer is option B, ear. The ear contains receptors for both hearing and balance. The functional unit of lungs is option A, bronchi, option B, alveoli, trachea, pleura. The correct answer is option B, alveoli. Alveoli are tiny sacs where gas exchange occurs. The process of removal of waste through urine is called filtration, excretion, absorption, secretion. The correct answer is option B, excretion. Excretion eliminates waste products from the body. The normal range of pulse for newborn is 60 to 100 beats per minute, 100 to 160 beats per minute, 70 to 110 beats per minute, 40 to 60 beats per minute. The correct answer is option B, 100 to 160 beats per minute. Newborns have a high pulse rate due to rapid metabolism. The largest artery supplying the brain is carotid, femoral, aorta, pulmonary. The correct answer is option A, carotid. Carotid arteries carry oxygenated blood to the brain. The white of the eye is called retina, cornea, sclera, iris. The correct answer is option C, sclera. The sclera is the tough white outer covering of eyeball. The colored part of the eye is iris, pupil, cornea, retina. The correct answer is option A. The iris controls the size of the pupil and gives eyes its color. The lens of the eye helps to detect color, focus light, produce tears, control size. The correct answer is option B, focus light. The lens focuses light onto the retina for clear vision. The normal human heart beat about 50 times per minute, 72 times per minute, 100 times per minute, 120 times per minute. The correct answer is option B, 72 times per minute. The average resting heart rate for adult is 72 beats per minute. The valve between the right atrium and right ventricle is mitral valve, aortic valve, tricuspid, pulmonary. The correct answer is option C, tricuspid valve. Tricuspid valve prevents blood flow into right atrium. The human body contains approximately how much blood? 2 liters, 3 liters, 5 liters, 7 liters. The correct answer is option C, 5 liters. An adult has around 4.5 to 5 liters of blood. The normal specific gravity of urine is 1.000, 1.010 to 1.030, 1.040, 2.000. The correct answer is option B, 1.010 to 1.030. Indicates kidneys concentrating ability. The body temperature above normal is called hypothermia, fever, hyperpyrexia, pyrexia. The correct answer is option D, pyrexia. Pyrexia, fever, hyperpyrexia is more than 41 degrees Celsius. It is called severe. The normal respiration ratio between inspiration and expiration is 1:1, 1:2, 2:1, 1:3. The correct answer is option B, 1:2. Expiration lasts roughly twice as long as inspiration. The nurse should measure pulse per second if irregular. 15, 30, 60, 10. The correct answer is option C, 60 seconds. Count full minute to ensure accuracy in irregular rhythms. The most accurate site for core body temperature is oral, axillary, rectal, tympanic. The correct answer is option C, rectal. Rectal temperature closely reflects core temperature. Sterilization kills bacteria only, all microorganisms including pores, viruses only, fungi. The correct answer is option B, all microorganisms. Sterilization completely destroys all forms of microorganisms and spores. Disinfection destroys all microspores only, pathogenic organisms, virus only. The correct answer is option C, pathogenic organism. Disinfection eliminates most pathogens but not spores. The best method to sterilize surgical instrument is boiling, autoclaving, dry heat, chemical solution. The correct answer is option B, autoclaving. Autoclaving, steam plus pressure, ensures complete sterilization. Normal saline solution contains 0.45% sodium chloride, 0.9% sodium chloride, 1.8% sodium chloride, 5% sodium chloride. The correct answer is option B, 0.9% sodium chloride. 0.9% sodium chloride is isotonic with body fluids. The main goal of hand washing is soften hands, remove visible dirt, Prevent infection, increase blood flow. The correct answer is option C. Prevent infection. Proper hand hygiene breaks the chain of infection. The first link in the chain of infection is mode of transmission, reservoir, causative agent, portal of entry. The correct answer is option C. Causative agent. The infection cycle begins the microorganism itself. The process of cleaning an area with soap and water is called disinfection, asepsis, medical cleaning, sanitation. The correct answer is option D. Sanitation removes organic matter before sterilization or disinfection. In CPR, the ratio of compression breaths in adult is 15:2, 30:2, 20:2, 25:2. The correct answer is option B, 30:2. 30 chest compressions followed by 2 rescue breaths. In case of burns, the first step is apply oil, cool with water, cover with cotton, break blisters. The correct answer is option B, cool with water. Cooling reduces tissue damage and pain. Fracture means dislocation, break in bone, muscle, tear, joint strain. The correct answer is option B, break in bone. A fracture is a partial or complete break in bone continuity. First aid for a fracture includes straightening bone, immobilizing area, massage, ice application only. The correct answer is option B, immobilizing area. Immobilization prevents further injury. Shock is high BP, low BP, and inadequate perfusion, fever, bleeding. The correct answer is option B, low BP and inadequate. Shock is failure of circulation that leads to inadequate tissue oxygenation. Sign of hypovolemic shock is bradycardia, cold, clammy skin, flushed face, slow breathing. The correct answer is option B, cold, clammy skin. Reduced blood volume leads to pulse, cold skin, and rapid pulse. In nose bleeding epistaxis, patient should be positioned head down, head tilted back, head slightly forward, lying flat. The correct answer is option C, head slightly forward. Leaning forward prevents blood from entering airway. The first step in case of poisoning is induce vomiting, identify poison, give milk, give water. The correct answer is option B, identify poison. Identification helps guide correct treatment. CPR should be started within how many minutes of cardiac arrest? 1 minute, 2 minutes, 4 minutes, 10 minutes. The correct answer is option C, 4 minutes. Brain damage can start after 4 minutes without oxygen. The main symptom of heart stroke is cold skin, sweating, dry, hot skin, shivering. The correct answer is option C, dry, hot skin. In heat stroke, sweating stops and body temperature rises dangerously. In frostbite, affected areas should be rubbed, rewarmed slowly, exposed to fire, immersed in ice. The correct answer is option B, option B, rewarmed slowly. Gradual warming prevents tissue damage. Artificial respiration means mouth-to-mouth breathing, blood transfusion, CPR only, injection. The correct answer is option A, mouth-to-mouth breathing. Artificial respiration supplies air to lungs when natural breathing stops. The first step in fainting is give water, lay patient flat and raise leg, give food, sit up. The correct answer is option B, lay patient flat and raise legs. Raising leg improves blood flow to the brain. The normal range of body temperature in degrees Celsius is 35 to 36, 36 to 37.5, 38 to 39, 40 to 41. The correct answer is option B, 36 to 37.5. Normal body temperature is 36 to 37.5 degrees Celsius. The condition of abnormal low body temperature is hypothermia, fever, shock. The correct answer is option A, hypothermia. Hypothermia means body temperature below 35 degrees Celsius. The best site for measuring pulse is in emergency. The best time for measuring pulse in emergency is radial, carotid, brachial, temporal. The correct answer is option B, carotid. Carotid pulse is strong and easily accessible during CPR. The vein commonly used for IV infusion in adult is radial vein, medial cubital, cephalic, femoral. The correct answer is option B, medial cubital. Medial cubital vein is the antecubital fossa and most accessible. The nurse should check IV site for pain and swelling, temperature only, color only, BP only. The correct answer is option A, pain and swelling. Pain, redness or swelling indicates infiltration or infection. Normal adult systolic blood pressure range is 100 to 120, 80 to 100 mm of Hg, 120 to 140 mm of Hg, 140 to 160 mm of Hg. The correct answer is option A, 100 to 120 mm of Hg. Normal systolic is equal to 100 to 120 mm of Hg, diastolic 60 to 80 mm of Hg. The normal pulse pressure is 20 mm of Hg, 30 to 40 mm of Hg, 50 to 60 mm of Hg, 10 mm of Hg. The correct answer is option B, 30 to 40 mm of Hg. Pulse pressure is equal to difference between systolic and diastolic. The site for IM injection in adult is deltoid, gluteus medius, vastus lateralis. All of these. The correct answer is option D, all of these. All are suitable sites depends on drug and patient condition. Angle for IM injection is 15 degrees, 30 degree, 13 degrees, 45 degree, 90 degree. The correct answer is option D, 90 degree. IM injections are given at 90 degrees to ensure deep muscle entry. The angle for subcutaneous injection is 15 degree, 45 degree, 90 degree, 60 degree. The correct answer is option B, 45 degree. 45 degree allows drug to reach subcutaneous tissue safely. The angle for intradermal injection is 10 to 15, 30, 40 degrees, 90 degrees. The correct answer is 10 to 15 degree. Intradermal injections are shallow to form a small blood. The most common site for intradermal injection is upper arm, forearm, thigh, buttock. The correct answer is forearm. The inner forearm is ideal for sensitivity Montague's test. Thank you all.